Because he's a 27-year-old healthy male adult, we least expected this from him. He was conscious throughout. Only after the second episode of the nausea and the throw up that he had, and he came back and the chair position was adjusted, that's when he entered. He was almost getting into coma stage, but he wasn't entering in. But we could know that his vitals were going normal, but the patient was not coordinating much with us. My clinic, we had a handful of freshers, be it the attender, the doctors on board, everybody were freshers. And because it's something that you've never heard of, you never know, and you never know that you've done the right to the patient.
Hi viewers, I'm Dr. Prince. Welcome to my channel Dental Treasures. So in this episode, we'll discuss about medical emergencies in dental practice. In the previous episode, we did discuss about the syncope and how to manage it. The description is given below. So in this episode, we'll discuss a different case. So today we have with us Dr. Nitya. Hi Dr. Nitya, welcome to my show.
Thank you, Dr. Prince. I'm privileged for being invited here. Thank you so much.
So for what treatment did patient approach you?
Patient approached me for scaling, that is for cleaning of teeth. And the patient was around 27 years. He was a male patient, and he was very active, healthy, and he had just returned from gym.
Did you ask medical history?
Yes, definitely. I did ask medical history. As we were taking the consent, I did see him giving me the answers, okay? And he was very precise too. And we did go about into deep history also. But because he's a 27-year-old healthy male adult, we least expected this from him. But he did give us a history of ill-sightedness.
So was consent essential?
We did, and I should say that was the best decision on the day that we ever did.
So did anyone accompany the patient?
No, the patient was all alone.
What was your first impression when you saw the patient?
He was a healthy adult male who was around 27 years of age, 6.2 to 6.3 height, with very good built, healthy, returning from gym. Just wanted to get his teeth cleaned. What more would you have? I had no clue about what was I ending up that day with, except for that looks can be deceiving.
So when did you notice that things were going out of control?
Okay, so as we started the procedure, we positioned him on the chair, and my attender was setting up the chair, and I started off the procedure. Patient said he's having gag reflex. So I told him if he's having gag, to sit a bit upright, and then we changed the chair position from supine to semi-supine, and then the little chair position didn't do much. He was still feeling gag. I told him, as every dentist does, if he's having any discomfort, to raise his left hand during the procedure, and I should abort the procedure immediately. And he did admit to it, and we were going fine. But this continuous nausea that he had never stopped throughout the procedure, as long as the procedure existed.
Did you panic at that time? So what were the things which is running in your head?
Not much, because initially everybody does have gag. So this was not a major trigger factor or something that could danger sign for me to actually consider something had gone wrong. Until the patient stood up and went to the restroom because he said he wants to throw up, I watched his gait and his working, and it was a little troubled. And that's when I noticed, and his speech was also slurry by then. He didn't have a stable speech, and his coordination of his eyes were also not that great. But then he did go to the restroom, and he threw up exactly before the sink and not in the sink. So because the patient had given us a history of ill-sightedness, and we couldn't take it a call also. So we said, okay, it happens, and because he's already nauseating so much, we put him on the dental chair back, and we asked him if he was fine, and the patient was absolutely fine. He said we asked him his consent on the chair that can we go ahead with the dental procedure, and he was fine. He said as long as he doesn't feel a gag again, so we can go along. So we had suctions, all active, So we said, okay, we can go ahead with it. And we made the position from semi-supine to erect. We almost made him in a sitting position, and we started the procedure. And then that's when we noticed the patient is having a stroke.
So was he conscious throughout the event?
He was conscious throughout. Only after the second episode of the nausea and the throw up that he had, and he came back and the chair position was adjusted, that's when he entered the stroke.
So what are the physical changes you noticed?
Yeah, see, what eventually happened is he bit on the mouth mirror as he was about to chew the mouth mirror. So that's not something that you encounter on a daily basis. So I knew that I had to pull out my instruments from the mouth because they have rotary speeds. So we stopped the procedure immediately. I told my attender to squeeze in the suction tip in such a way that you make a U loop, and then you just hold it so that he bites on the suction tip and I have enough space for me to retrieve my instruments. So I immediately removed my scaler and the mouth mirror, though he just bit it then. So we used the same suction tip to remove any pieces of the mirror if they were there on the mouth. And then his tongue was also monitored throughout. I hope he doesn't have a backfall of the tongue. So we made him sleep in the lateral position on the dental chair, and the dental chair from erect we made it semi-supine. And we made sure that he is alert, and we were constantly talking to him. And my clinic was run by another girl also, who was my business partner and my friend and a co-dentist, and she was on the board on that day. So I immediately reached out for help, and she came down, and we both were watching his vitals constantly, and we saw the patient was not responding. His eye movements were not coordinating. He had a very slurry speech, and he was almost getting into coma stage, but he wasn't entering in. But we could know that his vitals were going normal, but the patient was not coordinating much with us. He was drifting away. So we knew that this is a red sign, and it was an alarming sign. We had to take a call immediately. Luckily, we had a panel of general doctors also pursuing to various fields on the board. So we immediately contacted the neurosurgeon, who was very much available that day, and he immediately came in to rescue, and he examined the patient. And under various examinations, he was the one who told us that the patient is stepping in stroke and we have to push him to a high center.
So you had to call an ambulance?
Yes, we had to call an ambulance and shift the patient from our center to a higher medical center. And as the patient was accompanied by nobody else and he was all alone, we immediately took his phone and we asked him whom he stays with along with, and we had to pull in one of his friends on the show. And then the person came, and we also had to tell him that to bring the medical records, because his absence of his medical knowledge of what he was going through is what led us this. And we didn't want it to be the same, because we had to give this continuity from what happened from a dental chair for him to progress on. So we had asked him to get the documents, and which he did successfully. And it was almost the same time by the time he reached and the ambulance reached. So together with the attender, on the consent sign that we have handed over all the documents and all the necessities to the patient's attender, we took a sign on a consent and then sent the patient to leave the patient. And also we took a discharging sign from the neurosurgeon that at the time of discharge the patient was stable, steady, and we have sent.
What actually triggered this event?
Okay, so essentially this patient had a higher axial bone, and due to that, on the chair position of supine, it kind of impinges the blood vessel that supplies to the brain, to be in a very layman term. So which actually leads to stroke. The patient has had episodes of this earlier, but the patient was unaware that he is getting in a stroke. He always felt he blanks out. So even he was unaware of this, but he's had multiple episodes prior.
So did you complete the procedure?
No, because the procedure that day we had to shift him to a higher center procedure, and then when he came back to thank us that we did our best to save him on that day, we did ask him, but he was of no opinion to take it.
So how did this incident affect you?
Well, I was handling this patient, so I was very confident with whatever procedures and protocols I have followed were up to my best of knowledge, and I have done my best in giving everything. And also there was a medical management on the chair side done by me, which was administration of Avamin, which I'm sure most dentists won't know, but luckily because we had a pharmacy in hand, I was aware that I should be continuing it like that. So we took that protocol, and I knew that I have done my best, and also that patient doesn't have any comorbidities, and also his age factor played a major role. I know the patient would be completely fine.
So what steps have you taken to prevent this further?
I think a general awareness and CD program intuition in different colleges would definitely help or a show like yours would definitely voice out a case like this to many people, and they will also be aware to how to go about it. And definitely to patients who think they just blank out, it's not blank out. Please do an internal research properly about what you are going through. Talk to your doctors, be transparent to them so that it can help both of us.
So if patient returns for further treatment in the future, do you think you'll take up this case?
Why not? I think I would give him the best treatment than any other dentist, because I've been through the worst through him. So definitely.
And how did it affect others?
Yes, my clinic, we had a handful of freshers. Be it the attender, the doctors on board, everybody were freshers, and it was the first ever case in the first year of your practice. Something to this extreme was definitely traumatizing everybody, and my partner was almost in chills for around a week until she saw him return back normal, and once he came to the clinic and he was all fine and thanking us. Until then, I think she had such sleepless nights, and because it's something that you've never heard of, you never know, and you never know that you've done the right to the patient.
Any message to our viewers?
Yes, definitely. I would want to tell them not to neglect any subject or any topic, because you never know. I'm very sure I wouldn't have gone through a stroke when I was being taught medical emergencies. But when it came, I was really fortunate to have a dental practice along with a pharmacy and a polyclinic setup that eventually had a team around so that I could go about it very quickly. But if I would fail to, then I really don't know. Maybe at the cost of the patient, we would have lost a lot of things. Apart from our practice, so many things I would be answerable for, but I'm lucky we made it through. I should really thank everything that came along. It was of good use, and also I think my ability to pull in everything at that point and to take it off, my presence of mind would also take a lot of credit for that, because if I was just traumatized and taken back, I wouldn't have gone to and stood up and done what is needed to be. So yeah, I really would take a pat on my back, and I would definitely say that this is definitely one of milestones in my career as a dentist.
Thank you so much, Dr. Nitya. I'm sure this video will be of great help for others.
Thank you, Prince. Thank you for allowing me to share my unheard experiences. I hope it helps a lot of people to overcome a lot of problems and medical emergencies in particular when they're practicing. Thank you.
So medical emergencies in dental practice, it can happen with anyone irrespective of your experience. So please give importance to this topic, how to handle this. And yes, do check out the description which is linked below. If you like this content, do like and subscribe this channel, and do share it with your friends. Thank you so much.